It is Thursday, January 14th. It is our 168th COVID-19 Task Force update. On today's program, Lloyd Phillips will be here, as well as Lisa Westaway. But starting things off today with some news is from the Kahnawà Peacekeepers, their Public Relations Officer, Zachary.
Now, Joe. Good afternoon. Today, January 14th at 12:24 p.m., after receiving multiple calls reporting a business on Highway 132 selling tobacco products to non-locals in contravention of Task Force Directive 55, officers arrived at the establishment and directly observed the business selling tobacco to non-locals. The officer issued a ticket to the owner of the business. The total of the fine issued was $15,100. The cashier of the business was also fined $1,541. Since then, we've received calls from other business owners saying that if other businesses are staying open, then we're going to stay open too. Let me be very clear here. Businesses that refuse to comply with the directives set forth expose themselves to criminal charges if they do not comply. I'm going to read to you from Section 31 of the Kahnawà Emergency Preparedness Law, and that says, every person who contravenes any provision of this Kahnawà communal law or who incites a person to do so is guilty of an offense and liable to a fine not more than $10,000, not more than $1,000 in the case of a natural person, or to a fine of not more than $10,000 in the case of a corporation of partnership. Now, these fines were issued. It says not more than $10,000. I said a higher number. That's because there are court costs and there's contribution to a victims fund, and that's all taken at a percentage, and that's why the fine is higher, appears higher after this. So we have to be very clear here. If businesses continue, they will be charged. If they will continue to contravene the directives set forth, there will be charges that they will have to answer to. I want to point out again that none of this, nobody wants to be doing this to the community members, but these directives are in place for a reason, and they're there to protect our most vulnerable citizens. We're trying to keep it away from our elders, from our people with immune-compromised residents, and we've already seen at the Turtle Bay Elders Lodge, there are positive cases there. So it's clear that not everybody is adhering to these directives. Now, I encourage you, Kahnawà to take care of each other, to comply with these things. We can debate the laws later. If it turns out a year or so down that all of this was excessive and we went a little above what we should have, then that's fine. I will accept that because I will have did my part with the knowledge that was available at the time to protect my community. And everybody that's in this room with me is doing the same thing. They're sacrificing their time at home, they're sacrificing their health, they're being exposed here, and not directly exposed, but we're all together, and that's we have to we have to stay the course. You know, think beyond yourselves. If all that you're thinking of is your business and keeping money and keeping your business open, you know, I feel sorry for you because we all had hard times, right? Christmas was a bummer. Christmas was sad. New Year's was sad. I only got to see my parents for a short time on Christmas Day. You know, this is something that we're all suffering through, but the more that we come together and the more that we stay and follow the directives, the faster we can be out of this. And it's that simple. Just listen, take care of each other, take care of yourselves, and let's get through this. Thank you.
Thank you very much, Kyle. Of course, big news there today, and hopefully we will be heeding his words. Coming up next is the Commissioner of Public Safety and the head of the task force, Lloyd Phillips. Lloyd.
Thank you very much, Kyle, for your words, and thank you very much to the Kahnawà Peacekeepers for doing the job they have to do. And it's unfortunate that it had to come to this, but certainly it's the law of the community, and they have a job to do. I certainly hope that this will rectify the situation. But I just wanted to let the community know that the directive obviously is still in place, and we do have 99% adherence to the directive. It's unfortunate that you have one location who's refusing to comply at this point. And again, like I said, peacekeepers are doing what they need to do. Moving forward, we hope we won't have to be dealing with issues such as this. We want to hopefully have a positive spin on where things are going in the community, as we've been talking about the light at the end of the tunnel. We've been talking about vaccine being rolled out in the community. We do have some tough weeks ahead of us, but together, we will get through this. And I don't take any pleasure in having to stand here and speak about people getting fines and speak about people who are non-compliant. And rest assured, the peacekeepers are doing what they got to do. The task force will continue doing what we need to do to continue the safety and security of our community, because that is our primary and only objective, is to guide our community through this pandemic, with the least possible amount of impact on the lives and health of our community. It's unfortunate when you have lawyers getting involved and trying to undermine the work of our community, undermine the work that we're trying to accomplish in protecting our community, but we will deal with it day by day. But rest assured, there has been no special permission given to anybody to sell in the community. There have been reclassification of a couple of businesses to operate as convenience stores, but they have to be true convenience stores, and some have complied with that. But still, the sale of tobacco products to non-locals is strictly prohibited by everybody. So I just wanted to make sure that that's perfectly clear for the community. So moving on from that, unfortunately I had to give some negative news, and I hope the community understands the position that we're in, and we're doing what we can, and we'll continue to do what we can. But this morning, we were on K103 talking about the overall situation in the community, and I guess there's some positive developments, and some things that we have to certainly be mindful of. We talked about on the radio, and we put a release out today about rinks. There was an incident on Sunday where there was a asymptomatic individual who was at the rink from 4:30 till around 9 p.m., the town rink, and potentially exposed a number of people. We were unable to have our public health team do all the contact tracing, so we felt it was better off to have a public notice to notify people if you were there during these times that you should properly isolate. And if you do have any questions, you could contact the public health team for more information. But with that, we also issued a one household per rink, measure for today. That's going to be coming into effect immediately. So public recreation and sports recreation unit will be rolling out a sign-up schedule for the rinks for individuals who want to use them over the next day or so. There will be signage going up on all the public rinks that basically say it's for one household at a time. So those people who live in your home, you want to go enjoy the rinks, you want to enjoy some time outside, but it is only for one household at a time. Basically the people who live within your home. Again, this is done purely with the intent of minimizing the spread of the virus, and if there is somebody who does get infected, at least it's contained to one household, and we don't end up having an outbreak or more clusters in the community. As we said, back a couple weeks ago when directive was passed, and after New Year's, they said we will take time to assess where we are halfway through the month. Time flies. We are already mid-January. And we looked at it, the overall situation in Quebec. Obviously, it's important with the numbers, death rate and such that are happening around there. The situation with the hospitals and the over capacity issues at many hospitals that our community uses. We have to consider that as well. Obviously, and probably the most important factor, what's happening in our community. I could say things could have been worse. But fortunately, things have come to a level where we're on the cusp of seeing turning that corner. But certainly, we're not there yet. But it was only through the collaboration, of our community. People who have been abiding by this, staying home, providing essential services only, and businesses, which I take my hats off to, that have done a tremendous job, and even though through some rough times have understood the importance that we need to work together to see us through this. So there are some positive developments. Well, but we're not there yet at the point that we feel confident to say, we're going to start relieving some measures. We did say, let's give us another week. There's more information, there's more data. We're going to continue to be assessing. It will be retabled at the task force meeting next Wednesday for further discussion to see if we're at a point where we feel comfortable with relieving some of the measures that are currently in place within the community, including Directive 55 and other directives as well. We said we're going to ongoing assessment. Because like we said, we don't take pleasure in giving directives that limit people's economic activity, limit people's movement, or their freedoms. And we want to relieve that as quickly as we possibly can, but also safely as we possibly can. And so we will be doing that ongoing assessment over a week. And we will definitely have an update on those directives for sure next week. And again, it's very trying times, but there will be some information and pictures coming out very shortly of the vaccination center that has been established. It's very professional. It's a turnkey operation at this point in time. Final pieces of the puzzle are being put into place, and basically that's all we need to do is have the vaccine delivered to our community, which the work is being done as we speak, and when we get the vaccine in the community, we will start rolling that out to vaccinate the masses as quickly as we possibly can. And that's the end goal. That's what's going to get us through the pandemic. That's what's going to allow us to return back to a sense of normalcy. That's going to get us back to where we can once again be with our families, operate our businesses the way they used to operate, and live a healthy life. And that's the goal we should all hang on to. And it ain't that far away. We've been here 10 months. We got to hang in there a little while longer, and we will get there. So with that, thank you very much, and I'll pass it back to Joe. Manigawahi.
All right, thank you very much, Lloyd. And there's actually some good news coming up. We'll fill you in on that when Lisa is finished with her report. Just a little note on the skating, on the rinks. I know there are the public rinks, but there are also private rinks, and basically everybody should be playing by the same rules. So if you have your own rink, that's great, but please keep it to one household. That's what we're really urging everyone to do, and it's for all the right reasons. All right, coming up next is, as promised, from the Academy Memorial Hospital Center, Lisa Westaway. Lisa.
Hi, so I just want to provide a few updates. Again, I'll continue on the positive side of things. So firstly, with respect to the rink, since we had already discussed it, I wanted to thank the community for their attention to detail, their vigilance. We had many, many calls today, either from parents of children who were at the rink or people who had known of others who were at the rink. It allowed us to contact as many people as possible. And in fact, there were more than 20 people there. So just to note that this is, really important that we remain one household, that we not mix households. We have many people in isolation at the present time, but still a big thank you to the community for having reached out to the local public health team in order for us to ensure that people are self-isolating as they're supposed to. So just a small note about that. Some of you were recommended to come in for testing at the testing site. If you receive a negative result, you still need to self-isolate for the full 14 days. I spoke about that this morning. I think I speak about it almost every time I come on. We have several positive cases that recently developed symptoms on day 13 or day 14 of their isolation period. So although you may be feeling fine, you can develop COVID 14 days after a contact with a positive case. That's why if we ask you to self-isolate for 14 days, you must do so for the full 14 days. Sometimes public health will let you know that you can leave your isolation period, and that might happen at times. And if that's the case, if it comes from public health, then you can go back out. So I also want to give an update about Turtle Bay Elders Lodge. So again, this is a positive update. As I mentioned this morning and was documented in the memo, there were a few question marks regarding the case that was identified yesterday. So yesterday's results, so as you know, since the outbreak on the 31st of January, we have been screening all residents and all employees every 5 days for the full 14 days since the outbreak. So the result that we received yesterday was a result from the 3rd screen. So for all residents, screen 1, screen 2 was negative. For all employees, screen 1, screen 2 was negative. So when we came to screen 3, we received a result yesterday that was considered a weak positive. What does a weak positive mean? So the lab is able to identify when there is a small amount of virus in the results. It could mean one of 3 things. It could mean that a person is at the very, very beginning of their COVID-19 virus. It could mean that somebody is at the very, very end of the virus, or even had the virus several weeks prior, and there was still some virus in their system, although they're no longer contagious. And the very, very odd chance, it could also mean that there is cross-contamination, something that goes wrong at the lab during the testing. It just so happens that yesterday we did receive 2 weak positive results. Now there is a protocol, one at the Elders Lodge and one completely separate from the Elders Lodge. Now there's a protocol in place when you receive a weak positive. You retest that person 24 to 48 hours later to be able to determine whether they are at the beginning of the COVID virus or at the end of the COVID virus. And so the result on that second screen gives you a lot more information about that, because if it's negative, you know that they were probably at the end of the virus, and if it's positive, then you know that they're probably at the beginning. So again, this is not rocket science. This is not, black and white. There are some elements that are always to question. However, when we retested the Elders Lodge patient yesterday, the results came in today, and the results were negative. So that is really, really good news. With the 3 negative COVID screens prior, the weak positive, and then the negative test result that we received today, we are quite confident that this resident was not contagious during her stay at the Elders Lodge. And again, all residents have been in isolation for the past 14 days since the 31st of December. So there's almost no likelihood of transmission of the virus within the Elders Lodge as a result of this particular case. So we're just waiting final confirmation from regional public health teams tomorrow, but in all likelihood, tomorrow will be the end of the isolation period for all of the T-Bell residents. So I think that this will be very good news. And again, we will confirm through a communique tomorrow that this is the case. Last update that I wanted to give was regarding vaccination at the ILC. I had mentioned that that might take place this week, but in fact it will take place, and it is confirmed. Vaccination will take place for all ILC residents on the 20th of January in the afternoon. We are really excited about that. Once that is complete, then all of our 3 residences and our very vulnerable population will have been vaccinated with their first dose. So that takes place next Wednesday. And as Lloyd mentioned, our vaccination site is just about ready to go. Human resources are being prepared. The only thing that we're missing is the vaccines, and we are working on that as well. We've had several meetings with the province, with the federal government, and things are looking very positive. And our goal, as we've mentioned, is to fully vaccinate between February and March all community members. So again, this is dependent on many variables, most or especially availability of the vaccine. However, it is looking very positive, and we'll continue to keep you up to date. Thank you.
Thanks so much, Lisa. Before we leave, one note, actually it's a couple of notes related to the same topic. The KERM, the Kahnawà Economic Relief Fund, Measures Fund, there are quite a few people who are accessing that. There is a press release that's going out to talk about how you access it, so look for that. Also, some very big news, though, just announced a few minutes ago. A press release has been issued from the Mohawk Online and the Mohawk Council of Kahnawà, and Mohawk Online has actually declared a dividend of $3 million, which will be sent directly to the KERM fund. And we have been, like I guess everywhere across the country, people who need help have been receiving it. Kahnawà has its own fund, and we have, of course, received some funding from the Canadian government, but we're in a good position because we do have some money put away. And very good news today that $3 million has been added from Mohawk Online, and that's just great news. The original, if you recall, the original founding of KERM had $9 million that came from the various sources within the Mohawk Council of Kahnawà, and then the Mohawk Online donated $1 million to top it up to $10 million. A lot of that has been used up now, but now with today's announcement, there's a little more breathing room, so that's just great news. And there has been some good news today, as what Lisa and Lloyd said, and of course some more serious news as brought to us by Kyle from the Peacekeepers. So with that, we'd like to say thank you for joining us today. I know it's a lot of information to absorb, but we appreciate you being here, and take care of yourselves. We shall see you next time. On behalf of everyone here, Nyao Goa Dano, Wanigiwahi.